Happy Migraine Awareness Month, everybody. We are finding out all about the unique journeys that we have with migraine, because none of us really have the same experience, but some of us do well with some things and some of us do well with other things. The one drug that I'm, of course, most passionate about is Aimovig. I'm probably the most famous Aimovig super responder in the country. But here to help me talk about Aimovig is Suzanne, who was on Aimovig for a long time. Thanks, Suzanne, for joining us.
Thank you for asking me.
Very happy to have you here because you are actually one of the stories that I think people get value from, and that is people who were on Aimovig, did really well on Aimovig, and have now tried one of the others. So firstly, tell us a bit about yourself. Where do you live and what's your migraine like?
I live in Mildura, so I am very country Victoria. I am as far away from Melbourne as you could possibly be. And yes, I'm in the corner of New South Wales, South Australia and Victoria on the Murray River.
Thank you. Now, if you do live in that area too, we do actually have a local support group there. It's called the Sunraysia Migraine Warriors Group. Go look it up on Facebook. All right, tell me about your migraine.
Okay, I've had migraines since I was 12. I'm in my mid-50s now, so I have had them for a very long time, and I had migraine 24/7. So if I was lucky, I would have a couple of hours off from having a migraine every month. So I was had them all the time. I was at the stage where I pretty much was getting asked all the time at work, when was I looking at retiring? I could not function. I come from a family of migraine sufferers from both sides of my family. Both my mother and my paternal grandfather were migraine sufferers. I have a sister that's a migraine sufferer as well. So it's just there. Two of my children also have migraines as well.
So how long, like how many years were you all day, every day?
Probably from my mid-20s onwards.
So 20 plus years.
Yeah.
That's a pretty long slog.
It is.
So I'm proud of you for still being here, if I can say that as gently as I can, because one of the things that we are always concerned about as a community is that you get to a point where the relentlessness of it just gets too much.
Yeah.
So there is actually a day in Migraine Awareness Month, it's called Shine a Light Day, on June 7, where we acknowledge people who have died because of migraine. It's started by a charity in the US. It's never been done here, but we're going to include it in the schedule for this year. Anyway, let's go back and talk about more positive things. So I'm presuming you tried absolutely everything else before Aimovig.
I did. I'm actually very lucky that I have a very supportive GP. His wife also suffered from migraines, or it's his ex-wife now. But every time that he came across something that was new, he would trial it on both her and me at the same time. We're actually really close friends. We're actually in the same theatre group together, and we've known each other since the mid-80s. And yeah, so he would, as soon as he found out on something that he could prescribe, he would trial it on both of us to see if it worked. And then if it didn't work, he'd go, okay, now I've got to find something else. So we did eye drops. We did anything that he could possibly think of. He would try it on me to see if it would work. Sometimes it would work for a short time, and then it wouldn't work anymore, and he'd be getting really frustrated with the fact that it wouldn't work. So I am very lucky that way, that he would try anything he possibly could. And then it got to the point where it was, okay, I need to see a neurologist, because he just couldn't find anything that he could do, that he himself could do anymore, that it had to be a neurologist that did it then.
So you got referred off to a neuro?
I did.
And they probably would have gone the Botox route?
Yes, I did Botox for several years. In the meantime, though, I did have a cerebral hemangioma rupture. So I had to have surgery to remove that. And that was misdiagnosed by our local hospital as just another migraine. So my doctor went, that is not just another migraine, and he was the one that discovered that I had a severe rupture.
Mm-hmm.
And got me sent to see a neurosurgeon. And so, yeah, in between that and with my neurologist, that's when we had a lot more other things happening too.
Mm. So your brain's not happy. You've tried everything. You've had one of the complications that we who have unhappy brains have.
I've also got 2 brain aneurysms.
Oh, good.
Oh, yeah.
Yeah. Are you like collecting the set?
Yeah.
Stroke, imaginoma. Yeah, okay. We have to laugh about it, right? It's a bit of dark humor.
Yeah.
Migraine brains are very unhappy brains, and they do kind of present more commonly, particularly with aneurysms and strokes. So please do take it seriously. If it doesn't feel like your normal attack, don't let a doctor tell you that it is just a migraine attack.
Yeah.
Get it checked out, at least get an MRI. If you live somewhere where you do have MRI, which is not always the case. So, all right, how did you go with Aimovig?
Aimovig was absolutely wonderful. I started taking it in January 2019. And almost immediately, within a week and a half, the migraine stopped. Stopped.
Like somebody turned off a switch.
Absolutely. And I'm there thinking, this has just got to be like,
this can't be real. What's going on?
Yeah, this can't be right. I've got to be getting another, like, what on earth is happening? And I think it was about 4 months later, I got my first migraine, which was all of 3 hours. And I went, because I'm there thinking, yeah, one's got to happen. It's got to happen. And when it was only a day or 2 before the injection was due. And I'm going, okay, I'm running out. So that's obviously why I'm getting this little thing. It's because I'm due to have my injection. And I think in that whole 15 months, I did have one big migraine, which I ended up in hospital ended up in the ED department for a whole 72 hours, and I was counting. But it was a hemiplegic one, and so they were worried that I was having a stroke. I mean, I knew it wasn't a stroke because I've had the stroke symptoms before. It wasn't the same as when I did have it, but they were very concerned, so they kept me in the emergency department for 72 hours. But other than that one, I think I had about maybe 3 breakthroughs on the day or the day before that I was meant to have the injection, and they were only a couple of hours.
Pretty mild type thing. So I had a very similar kind of response, right? 6 days, it was like somebody flicked a switch and I was suddenly back. Like, hi. It's really quite a phenomenal feeling. It took me about 6 months to get to 0 migraine days. And then I stayed there for a year until I stupidly went off Aimovig, and we'll talk about that in a sec. But yeah, it's really quite phenomenal. So the first month I still had about 15 days, but that's down from 30, right? So I was same as you, all day, every day, had been for 8 years. To suddenly go to nothing, or close to nothing in a very, 6 weeks, and suddenly I have more days that are migraine free than migraine days from all day, every day for 8 years, is really quite a phenomenal shift. And one of the things I found, I don't know if you found the same thing, and certainly, it's been a bit of chatter about it online, is that the anxiety actually goes up. So almost everybody with migraine lives with anxiety, right? It's part of the package deal. But the migraine actually went up in anticipation of the next attack that was going to be massive. It had to be massive because I've been so good for so long. The next one's going to be bad. It took me months, like a good 6 months, to deal with that anxiety. And that was working with a therapist, the whole thing, kind of allowing myself, giving myself permission to be well. How did you find that transition from completely debilitated to I'm good?
Yeah, as I said, I kept waiting for it, like it was a case of when's it going to hit? When is this thing going to be? I kept expecting something bad to happen the whole time. I'm expecting something bad, and I mean, when I did have that bad one, I'm going, yep, this makes sense. It's going to be there, but then it just took longer and longer. I suppose you're right. It's that whole, it's
the anticipation, the fear of the next
yes.
attack is actually worse than the attack. Yeah.
Yeah.
Yeah. So you kind of come out of that phase, and you and I both had, you know, a good year of pretty good life, really.
Yes.
What led to the decision to come off it?
Pretty much we couldn't afford it. I only work part-time because I'm a part-time teacher, and I have this, at that point I had a child at university who is solely funded because we earn that little bit too much from the government, according to them, for them to be able to give him any money.
Yeah.
And yes, so, and I've got another child that's at home who has a mental illness, so we look after him. So yeah, we basically could not afford it. So I then transferred to something that was slightly more affordable. So
when you came off Aimovig, did you have a gap between coming off Aimovig and starting Emgality?
I didn't.
No,
I went straight from one to the other. I have ended up, I've got a lot of complications with Emgality. I've ended up with severe food allergies, but I can put up with that. I can put up with not being able to have coffee, gluten, lactose.
Maybe. It does make life harder though. Like, I mean, I've lived with allergies my whole life.
It makes life very hard, but I can put up with it if it means that I can still have most days migraine free. I still get migraines on it. I've had 3 this month. Yeah. But so it's not nearly as good as Aimovig. And I would go back to Aimovig in an absolute heartbeat if we could afford it. Yeah. And if it was at the same price, yeah, there would be no questions asked. Yeah. So I did basically the same thing, except that I took 6 weeks off, then tried a shot of Emgality, and Emgality didn't work. Like, it just did nothing. I was actually worse. Yeah. So I found coming off Aimovig that decline back to hell, and, you know, there's really no better word for it, it's migraine hell, was really rapid. Like, it, you know, like there was a couple of days where I kind of felt good, and then like about 2 weeks after I'd missed the first shot, I just woke up with the most enormous hemiplegic, full tilt, can't walk, can't sit up, can't eat, can't eat, can't drink, hemi. And it was just kind of hellish from there. I tried Emgality and it like literally did nothing. It was like I was taking placebo. If anything, I got more irritable and more moody, and I put on some weight. So I bit the bullet and went back to Aimovig, and I've gone all the way back to the beginning. So I've got, like there's really rapid improvement, but it's like the first 6 months. It's not like the next year where I was completely attack free. So it's like those, there's still a few breakthrough attacks. I still feel a bit aura-y, aura-y. There you go. There's a word. Just make one up. I know what you're meaning, because that was me on Tuesday. Yeah, premonitory symptoms are still there. The kind of feeling a bit weird, maybe occasionally feeling a bit euphoric, which I have a lot in the prodrome. The tingling of the aura or a visual aura. And then it's disappearing, which is good. And a couple of them are going through to a bit more of attack. But that's it, right? That's a massive improvement from can't walk, can't sit up, can't feed myself. Yeah. And that's what I think people don't understand, is that's the difference that we're talking about. We're literally talking about the difference between being completely debilitated or not for the price of $264 a month the government doesn't want to pay. Yeah. And that's what I don't understand, right? Is that why would you keep somebody in such a state of disability, unable to work, dependent on welfare or dependent on loved ones, unable to function, unable to be productive taxpayers, if it's such a small price? Yeah. It's such a small price to pay. For those of us like me and most of, the board of Migraine Australia, to be back in the world, in your case, in, the case of 2 of your children, it's,
it's the difference between being able to be a functioning member of society or being a burden on society, and we shouldn't be made to feel a burden. But more than that, we really shouldn't be made to feel like we aren't worth $264 a month.
Yeah.
Because that's actually really putting a price tag on our lives. And to be told that we can't have the same access to effective medications and universal healthcare as everybody else because there's too many of us just drives me around the bend.
Yeah.
Anyway, let's go back to talking about the drugs, not the politics, because I'll get too cranky.
I was going to say what was I found really interesting was when I was in hospital for those 3 days, one of the doctors, and not that they're doctors, one of the med students who pretends that they're a doctor, that was in the emergency department, I said that I was on Aimovig, and most of the time they look at me and they go, what? She said, oh, okay, my sister's on that.
Good.
And then when she said, and where's your pain? And I said, oh, it's at about a 5 to 6. She said, oh, so an 8 to 9 for any normal person.
Yeah.
I thought she knows.
She gets it.
Yeah.
She's one of our people.
Yes.
Absolutely.
So I thought that was really nice, actually having someone that relates to someone that has migraine and knew exactly where we actually stood. Because when they say, well, where's your pain level? Our pain levels are something completely different to anyone else's pain levels.
Yeah.
Yeah.
Yeah. Like I always reserve 10 for, passing out.
Yeah.
Yes. And it takes a lot for me to pass out. Like I remember once saying I was at a level 8 pain and having a nurse looking at me going, well, you don't look like it. And I'm like, well, I cry at 9 and I pass out at 10. So am I crying? And she said no. And I said, right, so I'm at 8.
Yeah.
And that's, that was migraine life for me for a very long time. And it's really quite cruel to have these drugs. And I was joking with someone the other day that I think about everything now in terms of Aimovigs, right? I need to get the car fixed, but that's one Aimovig. And I shouldn't be thinking that way. I shouldn't be thinking that I have to, value everything in my life by whether or not I can afford my medication. This is Australia. It's not the United States. It's not supposed to be like this.
Yeah.
But anyway, what advice, just to wrap this up, would you give to somebody who is either thinking about trying Aimovig or is on Aimovig and thinking about switching to Emgality?
Like for me, the reason to go with Emgality was, for a start, my GP could prescribe it, and I didn't have to keep going down to the neurologist, which for me is 3 to 4 days off work. So I would say if you could remain on Aimovig and you didn't have to worry about the taking days off work and things like that, absolutely stick to Aimovig. If money was not a worry, stick to Aimovig. I hope that the government gets off their butt and just doesn't. Please understand, we really need this. It's like Aimovig. As I said, if I could afford to go back on it, I would.
But there is a big difference between $263 a month and $695 a month. It hurts. If I could go to either Emgality or Ajovy with any confidence that I'd get anything out of them, even as you say, with more side effects, okay. I have no side effects on Aimovig at all.
Neither did I. A bit of dropping of hair, but I had masses and masses of hair, so a little bit of dropping meant nothing. Mine
actually is really funny, right? Because I feel bad for the people that have lost hair, because mine, I don't know if you can see, is crazy long, right? It just keeps growing. Like growing and growing and growing.
Mine was crazy. I've cut off stats.
Yeah.
Mine was crazy long as well. And my husband kept saying, I could actually make a carpet out of everything that you've dropped. And I just went, I'll just cut it. And I cut it to about here. And it's I've cut so much. I keep cutting so much off that it's not funny.
Yeah.
But I did lose a lot of hair. But then again, I said I'm in my 50s, and you start losing hair then anyway.
Yeah.
So.
Look, it is really, it is really kind of tough to sit here and go, here is this amazing drug who will fix your problem, and, you won't have any issues. And, most people, the vast majority of people, don't get side effects. There are, I think it's about 3% that get the constipation issues, right? Which is actually, that's fairly significant. And some people, it was quite bad, like they couldn't stay on Aimovig. That happens. But when you talk about taking, a good 25% to, somewhere between 25 and 30% for each of the drugs, being near curative rates, the kind of responses that you and I had, super responses. It's like, why are we even debating whether or not these go on the PBS? Why are we still debating it 2 years after these drugs became available? Like, it's just, anyway, I can get very, very heated on this particular subject anyway, but thank you very much for joining me to talk about Aimovig today, and happy Migraine Awareness Month.
Thank you for having me.